A traditional doctor looking at this space would be horrified and then say it's completely impossible. The waiting room is too small. There's no place for the triage nurse. I don't see where I'd stack my charts. I need more. I need 3 exam rooms just for me.
This is our infrastructure right here. We have a laptop. We go on the internet to a secure website, which basically enables the practice entirely.
Because I use Hello Health in the practice where patients can schedule online, because we can use virtual visits, email, and video conferencing when it's clinically appropriate, I don't have such high volume and throughput. And because of that, we can get away with a lot less space. The Hello Health prototype practice has been going since the summer of 2008. This practice on Morton Street opens in December of 2009 and is now stepping on the gas with a new doc on board. This is small, it's simple, but I'm thinking maybe a different desk setup.
The patient is able to schedule online. I have ability to change the appointment and let them know if something should come up.
I have this friending ability in this. I have an ability to tell people who I am through my profile, which is online. And if I don't finish everything right then during the day, I want to dash home and see my family, I can take a couple quick messages that night. Hello Health is Facebook's secure Facebook on steroids.
All of the medical record is available online, and we're on the web. So, even our storage space, we have no file cabinet. In fact, we have no we don't have a file drawer.
All that reduced staffing burden allows us to have a smaller physical plant, which means our rent is lower, which means we can charge less.
The reimbursement model for us works along the lines of we are not accepting insurance directly. We expect payment at time of service, and there's no collection expense then as a consequence either. And there are plenty of people who have a PPO option or a POS option. I'm just not going to handle that paperwork. They can go and submit it on their own. So a traditional doctor practice, I would say, would be probably at least 30% higher on a per visit basis.
The people who have no health insurance are very attracted to practices like this because of transparency and pricing and communication. People who have very high deductible are very attracted, and some who have full health insurance but are just sick of what they get in a typical practice are coming here saying, this is what I really want. This really is starting as a grassroots effort. It's working with practices and patients that both get that we can do it differently, and we're being very inventive. The last thing I would want is some big legislative agenda with all the political machinations that may prevent innovation. Let innovation happen. That's part of the beauty of America. We're out here innovating on the cutting edge, and it's a lot of fun.